Hello everyone, I'm so excited to introduce my book, Clear Aligner Technique. Clear Aligner Technique is published by Quintessence Publishing. It is written in an easy-to-read format with short paragraphs. At the beginning of every chapter, you can see the contents within each chapter, and there are numerous illustrations in the book with 35 case reports. I'd like to introduce the book to you in a series of questions. Who is this book written for? This book is written for all levels of dentists who would like to treat patients with clear aligners, whether you're a first-year dental student or a graduate student in orthodontics, or you may be a general dentist or an orthodontic specialist. No matter your level of experience, this book will help guide you through understanding the basic principles of orthodontic diagnosis and treatment planning, designing a ClinCheck software plan that meets your treatment goals and objectives, and give you clinical tips to carry out the treatment plan to get the clinical outcome that you desire. As you know, technology is always changing with many new innovations. Clear Aligner Technique was written from diagnosis and treatment planning perspective. It discusses time-tested orthodontic principles like biomechanics, anchorage, and occlusion, and then explains how to apply them to clear aligners. So this book is written for anyone who wants to learn how to treat malocclusions with clear aligners. Does this book apply for other orthodontic aligner systems or only for Invisalign clear aligners? This book is first and foremost a textbook in orthodontics. Although the cases treated in the book are Invisalign clear aligners from Align Technology, many of the principles in clear aligner treatment will apply to any clear aligner system. When a clinician decides to treat a malocclusion with clear aligners, they have to first make a diagnosis and then a treatment plan. In the treatment plan, there will be certain tooth movements that are required, such as extrusion, intrusion, rotation, or distalization. As doctors, we have to select the aligner system that is able to accomplish the type of tooth movements we require to correct the malocclusion. I attended a course in clear aligners. Why do I also need this book? When we attend a course or a conference, sometimes the topics are relevant to our practice and the patients that we see, and sometimes it is not so relevant. We may learn many tips and tricks to bring back to our practice for certain types of cases. However, many doctors want a systematic way to learn clear aligners with scientific evidence and a comprehensive overview for different malocclusions. At the back of every chapter in this book, you will find a bibliography with the latest research on clear aligners at the time of publication. This book is designed to be a clinical handbook. When a clinician plans to treat a case, they can refer to the chapter on that specific malocclusion. For example, a deep bite case. They would read Chapter 8 on deep bite treatment, and based on the information in Chapter 8, they will be able to make a diagnosis on what causes a deep bite malocclusion. There will be some discussion on the biomechanics and anchorage requirements for deep bite correction. They will learn about innovations they can design into the software, like precision bite grams, optimized deep bite attachments, and power ridges. They will understand how staging the tooth movements in a specific sequence will give better clinical predictability. Then each chapter has at least 3 case reports of the type of malocclusion treated with aligners, so that you can see how the recommended biomechanics, software design, and staging patterns work out. Let me show you an example of a deep bite case featured in a case report from Clear Aligner Technique Chapter 8. This is a teenage male, age 15 years old, and looking at his oral hygiene, you can see that he's not the best candidate for fixed edgewise appliances. He presents with a Class 1 deep bite malocclusion with minor crowding in both upper and lower dental arches. Both upper and lower incisors are retroplaned, and there is a steep curve of spee in the lower arch. This is the ClinCheck plan that comes back, and here you can see Smart Force features such as power ridges for incisor proclination, anchorage attachments on the premolars, level the curve of spee, and upper and lower incisor intrusion. From the overjet view, you can see the precision bite ramps appearing on the lingual of the upper incisors. Looking at the superimposition tool, you can see the amount of upper and lower incisor intrusion that's been programmed into the ClinCheck, leveling of the curve of speed, anchorage attachments on the lower first premolars. In the upper occlusal view, you can see the precision bite ramps on the lingual of the upper incisors. And in the lower occlusal view, you can see lower incisor alignment while maintaining pretty much the same labial-lingual position. This case treated out in 10 months without additional aligners. And that is the beauty of treating teens with Invisalign aligners. Teens' teeth track better, teens' teeth move faster. You can see we've corrected the deep overbite, the upper and lower dental midlines are coincident, and the teeth are well aligned with the curve of speed leveled out. The patient started off with a good class 1 buccal occlusion, and we didn't change that in the treatment. I am not an orthodontist. Can I use clear aligners? Yes, all dentists have some basic training in orthodontics in dental school, and there are many advanced orthodontic courses that you can learn if you're interested in doing orthodontics in general dental practice. The secret to being successful with clear aligners is case selection, case selection, case selection. Chapter 3 of Clear Aligner Technique discusses case selection for clear aligner treatment. In this table in the chapter, you will learn how to recognize cases that range from simple to difficult. For example, anything in the light blue is simple, anything in the medium blue is moderately difficult, and the black ones are the advanced cases. So if you're treating a case with mild incisor crowding through expansion, proclination, or interproximal reduction known as IPR, that's going to be a simple case. If you have a case with moderate crowding where you need to extract a low incisor extraction, that's going to be moderately difficult. And if you have a severe crowded case that involves premolar extractions, that's going to be an advanced case that may require specialist treatment or a practitioner with a high level of experience in clear aligners. May I use clear aligners for difficult orthodontic cases or complex malocclusions? The answer is yes, of course. A proper understanding of the biomechanics of clear aligner technique, together with the capability of digital treatment planning and proper treatment protocols, will lead to successful clear aligner treatment. This book lays out protocols for different types of malocclusions. In this example in Chapter 13, you can see the summary box that outlines the principles of premolar extraction treatment. And you will see these summary boxes at the end of every chapter. Clear aligner technique as a textbook has caused a paradigm shift in the way orthodontists perceive clear aligners. Before the book was published, most orthodontists thought of clear aligners as a simple orthodontic appliance that treated class 1 malocclusions with minor crowding and a lot of interproximal reduction, or IPR. And most thought that clear aligners are not able to finish a case to the same standard of excellence as we expect from fixed braces. When this book was published, many orthodontists were amazed at the excellent standard of the finished cases treated with clear aligners only, and also at the range of malocclusions in the book, from class 2 and class 3 malocclusions to premolar extractions and orthodontic surgery cases. Can I find clinical cases with different degrees of difficulty in the book? Yes, you will find many different case types in the 35 case reports in the book, each documented with pre- and post-treatment radiographs and cephalometric tracings and superimpositions. For example, here is a case treated with TADS that is a case report from Chapter 15 on interdisciplinary treatment. This patient presents with a class 2 malocclusion with facial asymmetry, canted maxillary-occlusal plane, and increased overjet. In the pre-treatment photographs, you can see she has a convex profile with protrusive, incompetent lip posture, a deficient chin button. From the frontal facial photograph, you can see she has excessive gingival display on smiling and the maxillary-occlusal plane that's canted down on the left. Intraorally, she presents with a class 2 malocclusion with increased overjet of 8 millimeters, 50% overbite, and minor crowding in both dental arches. So here's my diagnosis list. Class 2 malocclusion with facial asymmetry. Maxillary occlusal plane canted down on the left. Increased overjet 8 millimeters. Minor crowding in both dental arches. Convex profile with incompetent lip posture and deficient chin button. The cephalometric analysis, her A and B measures out at 8 degrees, and the SNMP is 49 degrees. We proposed an orthodontic surgical treatment plan for her, max reimpaction, and mandibular advancement with genioplasty. But this patient asked for a non-surgical option. And in the non-surgical option, we would extract upper first premolars, and then orthodontic treatment with selective anterior intrusion with temporary anchorage devices or TADs to correct the maxillary occlusal cant. If she chose a non-surgical option, she would have to accept the convex facial profile and facial asymmetry. This is the ClinCheck plan that comes back. You can see that as the extraction spaces are closed, the upper incisors are being retracted and intruded at the same time. From the buccal view, and this case was treated before the G6 premolar extraction protocol, you can see space closure, overjet reduction, and upper incisor intrusion. When we look at the superimposition views, you can see that we've intruded the upper left quadrant more than the upper right quadrant to correct the maxillary occlusal plant. From the buccal view, you can see the amount of overjet reduction, and from the upper occlusal view, the amount of incisor retraction as a result of closure of the extraction spaces. This is the patient 13 months into treatment. The extraction spaces are closed. There's still some spacing left in the upper arch, mesial to the maxillary canines and in the upper midline. However, both dental arches are already well aligned. This is the patient wearing the aligners and the elastics. You can see when she wears the aligners, there's an elastic that is worn from the buccal TAD to the lingual TAD. The temporary anchorage devices or TADs offer a point of anchorage, and the elastics helps the intrusion that's been programmed into the aligners express itself for greater clinical predictability. Here's the patient when she completed wearing the first series of aligners. You can see that all the extraction spaces are closed. We've lost a little bit of anchorage in the upper right buccal, and the dental midlines are still not coincident yet. At this point, we scan her and we make additional aligners. And here are the final records after wearing additional aligners. In the before and after comparison, you can see the reduction of overjet, the midlines are now coincident, and the buccal occlusion has been finished class 1 canine and class 2 molar. But most significantly of all, when we look at the pre and the post-treatment facial photograph, we can see the power of clear aligners when used in combination with temporary anchorage devices. The excessive gingival display has been corrected, as well as the maxillary occlusal cant. I'd like to introduce you to my website, clearalignertechnique.com. If you want to find out more about the book, this is the place to go. Here you can see the insides of the book. You can look at the contents of the book. In chapter 1 to 6, we lead you through a process of how clear aligners work, case selection, designing the software plan, digital workflow, monitoring treatment, troubleshooting, finishing, and retention. And then from chapter 7 to chapter 15, we classify it by different types of malocclusion and talk about the diagnosis, treatment plan, staging patterns, attachment design that's required to treat each type of malocclusion. And this is illustrated with 3 case reports in every chapter. You can also read reviews about the book from the Journal of Clinical Orthodontics and the American Journal of Orthodontics. Finally, you can purchase the book in the language of your choice on this website. What do you see as the future of clear aligners and orthodontics? I think clear aligners is the future of orthodontics. I practice in Vancouver, Canada, and my orthodontic practice is 80% clear aligners and 20% fixed appliances. In today's world, even parents as young as 8 years old are asking for clear aligner treatment for their children. They're asking for this due to the many advantages of less pain, ease of use, maintaining oral hygiene, being able to eat anything while the orthodontic treatment is in progress. Most of all, aligners do not interfere with other areas of the patient's lives, whether it's playing soccer or a music instrument. Let me share a case with you. This is little Jaden. He's 9 years old and he's a martial arts champion. When he first walked into my practice and said, Dr. Tai, could I have clear aligners? I said, Jaden, tell Dr. Tai why you would like to have clear aligners. And he said, I am the jiu-jitsu champion for the province of British Columbia. I do martial arts all the time. I cannot have metal braces on my teeth because if I get hit, it's going to cut up the inside of my mouth pretty bad. This is what Jason presents with, a class 1 malocclusion in mixed dentition with deep overbite and severe lower incisor crowding. And I said, yes, Jaden, we will treat you with Invisalign first clear aligners. Here's Jaden at his first appointment back in our office after 8 aligners. You can see the deep overbite is being corrected. There's some dental alveolar expansion going on. And here he is at the end of 5 months at the completion of his treatment. The deep overbite has been corrected. The dental midlines are coincident. Both upper and lower dental arches have been nicely developed, and we have left some space, mesial and distal, to the primary canines for the future eruption of permanent teeth. Here's the before and the after comparison in 5 months of treatment with no additional aligners. This is the day Jason got his attachment bonded on in our office. His mother was very excited for him, and she took these photos. This is Jaden and I flashing our matching smiles. And then Jaden sends me a photograph and says, Dr. Tai, these aligners are great. I'm doing my jiu-jitsu and wearing my aligners. And finally, Mom sends me this photo when Jason wins the gold medal. And she says, my golden boy, and wearing your Invisaligns. So as we think about the impact of clear aligner technology, not only in our practice of dentistry and orthodontics, but in our patients' lives, in the preface of the book, I write, as we harness the power of the digital world to move teeth and design occlusions, let us not forget that at the very core of our profession of orthodontics, we are changing smiles and changing lives. The future is clear.